about 1,000 patients. The EMS container can treat about 500 patients, in that range. There's what the container looks like. Looks like an aircraft, for baggage container. It is padlocked, it is wired, and as I said, once you open it, it automatically calls the CDC and the marshals. Okay. Here is what happens. You break the seal on it, slide the latches over, lift the door up and out. Once the door is out, the phone call is being made automatically. Each of those containers is pre-wired to a phone line. Okay. These can be requested. The entire container can be rolled into the back of an ambulance right off the loading dock. Okay. So, if something was to happen up here, and you needed these, you didn't have your extra supply, you could make the call down to Denver paramedics. They can load this and get it to you, 20, 30 minutes from the time of the request. Okay. Questions on the nerve agents? Or
I just thought it was a normal pharmacy. Let's say one of our greenhouses, there's 20, 30 victims.
Mm-hmm.
Would it be, I'm just thinking about dispersing them to multiple hospitals versus being at Denver Health where the ChemPack is?
The patients, you mean?
Yeah.
Yeah, most of the time.
I don't want all of them down at Denver Health, even though you have the ChemPack.
One is you don't want all of them. Two is doing it that way will further delay treatment. Okay. So my suggestion is bring the treatment to the patient as opposed to the patient to the treatment. I think that's a little easier. Okay. If you did have 30, 40 victims, okay, it's going to take a while. They're all not going to get to Denver Health in 30 minutes. Whereas I can get you the antidote in 30 minutes and you can treat them on scene. Okay. And you've got the medication working during the transport. So to me, that's the advantage. I will also mention that atropine in particular comes as a free-dried preparation. It's, we're talking industrial strength atropine. Has a shelf life that you can measure in like 2 decades. Okay. For this purpose, it would be terrific. The downside to that is it has to be reconstituted, and it has to be reconstituted under a chemical hood. Okay. So, hospitals can do that, and I actually recommend to hospitals that instead of them storing a whole bunch of Mark 1s, which have a finite shelf life, if you're going to store something, store the freeze-dried atropine, and then your pharmacist can reconstitute it in the pharmacy. Okay. All right, blister agents or the vesicants, sulfur gas, sulfur mustard gas, and lewisite. Okay, and you can see from the picture what the primary effect is. The primary effect is that of a burn. Okay, chemical burn, but a burn nevertheless. Okay, mustard, widely available. Many countries still have a huge stockpile of mustard. It is both a vapor and a liquid threat. Okay. The bad thing about two bad things about mustard is, number one is you can get exposed to mustard and not know it because it has delayed onset of symptoms. Okay. In fact, the delay is 6 to 8 hours. Okay. So you can get mustard on your skin, and if you didn't realize it, that's the delay. Okay. It also has not just skin effects, but systemic toxicity, very similar to radiation. We'll talk about that. Top picture is a picture from World War I. The bottom picture is a picture from the Iran-Iraq War in the 1990s when Iraq attacked Iran using mustard. Significant number of Iranians injured with that. Okay. Mustard. The thing about mustard is the effects clinically are delayed. The damage is almost instantaneous. When you get exposed to mustard, it is damaging DNA, and that damage happens in 5 minutes. Even if you decon somebody 10, 15, 20 minutes later, the damage is already done. Okay? So you're going to prevent secondary contamination, but that victim is still going to show you the signs of mustard exposure. The picture that you see here, this is a U.S. military worker who got a drop of mustard through one of the grommets in his boot. Okay? Didn't realize it, went home, about 6 hours later developed a blister. Okay? So delayed onset, didn't even know he got exposed. Get it in your eyes, anything from a very mild irritation, mild conjunctivitis, to severe conjunctivitis, spasm of your eyelids, corneal opacity, corneal ulcerations, total loss of vision. Okay. Now the good news is, at least in World War I, most of the victims had mild to moderate irritation. 1% had permanent damage to the eye. Okay. There's mild conjunctivitis. Okay. You can see the redness. It's a mild case. Okay. Skin injury looks like a chemical burn. You can see redness, you can see blistering, you can see necrosis. Okay. Again, these photos, Iraq victims. Get it in your airway, irritation to the airway, sore throat, runny nose, maybe a bloody nose, hacking cough, hoarseness, and then shortness of breath. Okay. GI tract, here's where it looks like radiation. Okay. Damages the GI tract. You get tissue destruction in the GI tract. Nausea, vomiting, diarrhea, bloody diarrhea as that destruction progresses. And then you can get infection as your GI tract lining is destroyed. Okay. And then much like radiation, this thing damages bone marrow. Okay. Damages your white cells, decreases red cells, platelets. If your white blood cell count drops down below 200, you're not going to survive. So we're going to follow your white blood cell count. Okay. Treatment, the ideal is decon within the first 3 or 4 minutes, so you minimize the damage. Unfortunately, most of the time, if you don't know what happened, it's not going to help. Okay. So decon them anyway, sure, because you want to prevent cross-contamination, secondary contamination. Everything else is supportive care. There is no other treatment for exposure to mustard. Okay, it's supportive care. Yeah, we'll treat the eyes with a variety of medications. Okay, the airway, supportive care. Cool mist, oxygen, intubation and ventilation if you have to. Bronchodilators, just like for an asthma patient. Okay, if they get infected, if they get a pneumonia, we'll treat them with antibiotics. Now, the other vesicant is called lewisite. Lewisite was actually developed here in the US during World War I. We never actually used it. It was loaded on ships, sent to Europe, but the armistice occurred before we deployed it. Okay. Lewisite, unlike mustard, causes immediate symptoms. You get exposed to lewisite, you're going to know it. It causes immediate burning. Okay. Causes the same skin effects. Redness, blistering, necrosis. The good news is it has no systemic effects. So it does not affect the GI tract, it does not affect the bone marrow. Okay. The other good news about lewisite is we have an antidote, British anti-lewisite. Okay. So we can treat it, it's fairly effective. So decon these folks, we'll call the CDC to get the antidote, and then supportive care once again. So blister agents, they damage eye, skin, respiratory system. Mustard damages the GI tract and the bone marrow. Mustard acts quickly to cause the damage, but the symptoms are delayed. Lewisite acts quickly, symptoms are immediate, and we have the antidote. Decon them all. The pulmonary agents, okay, phosgene, chlorine, ammonia, all widely used in industry. All of these things roll down our streets and our railroads every day. Okay. All of them have similar effects on the upper respiratory tract. Okay. One of them in particular has delayed effects. We'll talk about that. And all of them are treated exactly the same way, supportive care. Okay. So I'm going to go to this slide instead. The effect of these agents depends on how easily they dissolve in water. okay? If they dissolve easily in water, highly water soluble, like ammonia, the effects are mostly in the upper air passageways, the nose, the throat, okay? Because the minute it hits water, which is nose and upper airway, very moist, it's going to dissolve, it's going to cause irritation there. Chlorine, moderately water soluble, so it'll get further down into our air passageways. It'll cause irritation of the nose and throat, as well as the trachea and the bronchi. And phosgene, not very water soluble. That means you can breathe it in, you'll breathe it all the way down into your lungs, and it starts to react in your lungs, okay? Ammonia, you all know what ammonia smells like, okay? Widely used in industry to make a variety of products, okay? Anhydrous ammonia, this is the really bad stuff because it is so corrosive, okay? It is so alkaline, pH of greater than 12, whereas the stuff we use at home, you know, it's a mild alkali. Causes necrosis of everything it comes in contact with. The picture of the eyeball that you see there, okay? The right-hand side, that's an eye that was exposed to anhydrous ammonia. You can see the cornea is completely opacified. Nothing you can do for that. You can hope for a corneal transplant, but not going to do much there. Damage to everything it comes in contact with. Eyes, lungs, GI tract if you decided to drink the stuff, okay? So bad news. Here's another one. This is a patient who had exposure to the eye with ammonia, and fluorescein